we worked on during the past year in response with Dr. Ruiz, who is the head of University Health Centers at Montclair State, in response to educating students during the pandemic. Next slide. Okay, so our objectives are to discuss the registered nurse to be in learning needs and how we have to meet community and population health educational goals, which are part of the essentials that we have to meet in creating an educational program. And in this case, for registered nurses, our school offers a program for nurses who already have an associate's degree and are registered nurses, but need to complete a baccalaureate degree. And their needs, since they are working registered nurses, are different than those who are becoming nurses and going through a traditional education. These are sometimes people who've been out of school for a year to anywhere to 30 years or so. So their needs and their knowledge are very different. And in this case, because of the situation, we were able to develop a collaborative program between the School of Nursing and working with experienced registered nurses to give them new knowledge in population health, University Health Services, which was responsible for monitoring and keeping the campus safe during the pandemic. And we worked together as collaborating in this, and Residential Life. This is a university that has about 20,000 students and about 5,000 live on campus and about 16 or 15,000 are commuters. So there were a lot of interactions and a lot of moving parts that had to work together to keep this community safe. And it was a very, very challenging experience, but also very useful for those of us because students and faculty and staff truly work together in a collaborative manner. And finally, of course, the objective is to explain how we met the essentials for nursing, specifically the one that looks about community and population health. Next screen. So in creating this initiative in this group, we had to determine how we could safely operate a campus community during a global pandemic. And as I kind of mentioned before, we have students who reside on campus and take courses on campus. So if we think about that, that's one specific little bubble that has a certain amount of safety built into it because they're not going outside. But we have a larger community of students that are commuting from the suburbs around us. So anything that was going on in the pandemic, we had a flow in terms of the different counties. We'd have to watch their rates to understand how that could impact the campus community. And additionally, know that all students or many students work. Many of them work in service industries such as restaurants. Many worked as healthcare workers. So that became another point of understanding the campus community and its different parts. In terms of this, we know the community health content is required in the United States for nurses who are pursuing a Bachelor of Science in Nursing degree. So we were not able during the pandemic to meet the usual requirements through the usual clinical assignments that we normally would have because of social distancing and the other requirements that were in place for safety. Clinical experience in public health is essential, again, for a person who is a BSN candidate. So they not only had to have theory, but they had to have these clinical experiences. They had to meet a certain number of hours, and they had to be able to demonstrate that they met competencies. So by joining this work group and having us all together, we created a fairly novel approach to meeting this requirement that we do see can be beneficial moving forward. Next screen. So as I said, what was our method? Our method was to say, in the course of the pandemic, it was all hands on deck. And how could we treat the campus as a community? Because it is a community. Students are taking classes, and we also have the employees being people who work in facilities. We have a police department, we have EMS, and of course we have the faculty. So it was treating the campus as a community and looking at each of these populations in a unique way. Specifically, the way the registered nurse to BSN students who were taking the course that we assigned this to work was they worked as case managers and contact tracers. And in this sense, It was very good because they could work within their own schedules. As I mentioned, these are working adults with jobs and many other family responsibilities. And how could they work in this situation? So we were able to create a mechanism by which they were able to work hours that would meet their needs and address the needs of the community. Because again, we were doing case management and contact tracing throughout the day because people have different schedules. So the first part involved, after the decision was made to do this, was training these nurses to engage in telehealth practices to assess the cases and exposure and risk, and also to track other students and other members of the community if indeed there was an exposure. We did this through a number of ways. One was which Johns Hopkins created an excellent course that explained contact tracing specifically for COVID-19, and it was offered through Coursera. And students took that course. They then began to engage in a practicum, and they had a mentor. So the student was assigned to a mentor, and they began by working with the mentor to understand how they specifically would go and talk to each case, maintain confidentiality, create an environment where it was possible to have the discussion, understanding sensitive information. And they had to really learn the campus and what it was like to live on the different parts of the campus, or to be a commuter, or to understand what classes you were in and how you were near or not near other students. Frequently, it was also training these students how to then corroborate the discussion you had with the student by finding the right professor and talking to the professor and making sure what you were told was accurate. Additionally, a lot of times we had students in specific areas where they had to learn, and again, done with a mentor, how do you contact, we have a very large arts community, and students in the arts have closer contact than 6 feet, and there were special precautions taken for them, or students in athletics. So beginning to understand how to reach the different areas, how to talk to the different persons responsible, and to ask the right questions of students who were in these different disciplines was also important. It was done through mentorship. As students became more proficient in this, they were assigned individual persons that they could work with, and then they reported back to the person who was the manager for the day, who checked in to make sure things were going correctly. Again, a big part of it was learning to refer the campus partners that I kind of mentioned already to understand who had been in contact. Students also had to learn how to make the right recommendations for isolation or quarantine. And a lot of times that involved having a formal relationship with the resident's life person, and especially on weekends when you had to contact that person with the right information and say, this student must be moved and put into isolation for the next 10 days, and make sure an email was sent out. When a student's put into isolation, it means that their meals have to be delivered to the door, making sure that person had enough anti-inflammatories or whatever they needed to have enough resources in that situation. And sometimes students would have to say, we agree, we need to refer to, just people were isolation or 10 days, and quarantine for 14 days is difficult for a college student. So these again became other things we do in terms of the assessment and the learning practice and the interactions that were fostered through this. Next slide. So what was the result? So far, we continue this initiative. It is ongoing. We work to ensure that we have had safe campus operations. And indeed, when we look at the percentage of positive cases, the percentage of spread in relation to the underlying communities outside of us, we are doing fairly well at mitigating spread. We're able to identify people before they actually end up, we are able to identify people fairly early in the course by doing this kind of identify the index case and then find out who the person was in contact with. So we are actually in contact with students before they may turn positive or infect other students. Results, definitely participation as a member of a collaborative team. We've seen new relationships. We've seen people working together. And definitely they've learned telehealth. We've all learned telehealth through this experience. And it is a different way of doing community nursing, but clearly we worked with the population and we were looking at outcomes, and they had a lot of different experiences about meeting needs, identifying risk within the community. Advance. We did meet, and we know this from the first students who went through the initiative, that when they looked back at their evaluation of the course, they felt they did meet the American Association of College of Nurses requirement for Essential 7, which is clinical prevention and population health. This was again done through this particular course, which was Nursing 430 and 431, one being the theory and the second part being able to apply this through this clinical experience. It also provided everyone involved, including the students, to constantly look at what the Centers for Disease Control were giving us as guidelines, which were evolving, to look at what the state of New Jersey was giving us, because sometimes they were similar and sometimes they were different, and to compare as well as what higher education was saying. So we were working with different sets of guidelines. We were all talking about it, and it gave students an understanding of that as well. Advance. So again, they understood public health, very interesting experience in terms of telehealth, definitely a lot of team communication between groups that have never met before. And we have really established a collaborative network. The network has expanded, and now we go through case review every day to make sure, as we review everyone's notes and the data, that we are capturing what we need to as we prepare reports to inform the campus and keep working toward making decisions on policy on how we keep moving forward. So their work is involving policy. Advance. So we decided that this campus-based activity, born from necessity, does align with community health and population health focused promotion activities for a registered nurse who is achieving a BSN. It does meet the essentials as determined by the faculty and the students. And it clearly has been a tremendous service to both the student and the campus community as we work through the pandemic. And I think we are operating safely. We continue to be able to keep the campus open, and we have been thinking globally, and this is the application to a very local aspect of doing that. So I think that's it. Last slide. We are going to continue to meet the community and population health requirements. And I think what we have learned in general from this is that we can do this in a college environment, that colleges are truly communities. There are more opportunities to continue and expand the telehealth work. And that is something we see ourselves doing as we move forward. Next. So again, thank you. I'm Janice Smolowitz. Patricia Ruiz, pictured below, is on the bottom, is the director of the University Health Center. And I thank my colleague, Dr. Reinisch, very much, as always.